Hi there. How's it going today?
Good. How are you doing?
Very well, thank you. Dr. Ison, where are you originally from?
I'm originally from Florida, although now I live in Chicago, where I work at Northwestern University, Feinberg School of Medicine.
You answered my next question then. Please tell me about your educational background.
Yeah, so I went to college in Grinnell College in Grinnell, Iowa, then went back to Florida for my medical school, out to Oregon for my residency, to the University of Virginia, where I did my infectious disease fellowship and really got passionate about influenza. Then was up in Boston at Mass General to do some additional training prior to coming to Northwestern, where I've been for 13 years.
And what is your present title?
I'm a professor of the Department of Medicine in the Division of Infectious Disease and professor in the Department of Surgery in the Division of Organ Transplantation.
Now let's start with a real basic for you. What is the flu?
So flu is a virus that causes a respiratory illness. It's characterized by patients getting very sick very quickly. So they can be fine in the morning and then all of a sudden feel miserable in the afternoon. Patients typically have fever, body aches, and cough, as well as other respiratory symptoms. Many patients call a lot of illnesses the flu, but really it's a respiratory illness. So if you have other things like severe nausea and vomiting or diarrhea, it may be something else.
Now, how do you tell the difference between a cold and the flu?
Yeah, sometimes it's challenging because some colds can be really severe, but in general, patients that have colds have milder symptoms, less commonly have fever, have more runny nose and itchy eyes, whereas flu is really high fevers, aches and pains, cough, and just really feeling crummy.
Now, how long does the flu typically last?
The flu for normal healthy patients lasts somewhere between 5 to 7 days, but if they're given treatment, that can be shortened up by about a day.
Now, why are some people so scared of the flu?
Well, I think people, particularly those people that have underlying medical conditions that are over the age of 65 or morbidly obese, are concerned about the flu because it can actually make them so sick that they require hospitalization, and even so sick that they die from the influenza.
Now, most people are told to get their flu shots back in October or November. Is it too late to get them now?
Yeah. So the flu shot's recommended for everyone greater than 6 months of age, and really it's best to get it as early as possible to prevent you throughout the entire flu season. But the flu season's ongoing currently with a lot of areas experiencing high rates of flu now, and the flu season's expected to continue for about 3 more months, so it's not too late to get your flu shot. If you haven't gotten it, I'd go out and get your flu shot right away.
And what are the best ways to avoid the flu?
The best ways to avoid the flu or to get the flu shot, that's probably the most important thing. But then also washing your hands as often as possible and avoiding people that are sick. If you get sick and feel like you have the flu yourself, you should stay home so you don't share that illness with other people, or if it's your child, keep them home from school. Again, washing your hands and being careful with how you sneeze and cough so you're not spreading your germs to other people.
If you're unfortunate enough to get it, what are the best treatment options?
Yeah, the important thing is if you think you have the flu is to call your doctor right away. Most of the therapies that are approved for the treatment of flu are most effective if you start treatment within the first 1 to 2 days. So trying to get in sooner is always better. There are a number of different flu medications that can treat the flu, and as I mentioned, they improve the symptoms by about a day. The treatments hopefully will also reduce the risk of hospitalization, death, and other complications. But really the goal is to get you feeling better faster, and that's what these medicines do.
Now, if you are going into the doctor's office, what can you do to avoid getting other people sick?
I think the critical thing is if you do feel like you're sick, either wearing a mask or being very cautious when you cough and sneeze so that you're not sneezing on or coughing on other people, washing your hands carefully before touching things such as doorknobs, pens in the doctor's office, and not going to work to get other people sick.
Are any old wives' tales correct in regards to getting better from the flu faster?
Really, things like staying hydrated and eating enough food really do help you get better. But really, the key is to get in to see the doctor so you can get started on an antiviral for flu, because that's what's been best shown to shorten the duration of illness.
Now, please tell me about this new antiviral.
Yeah. Well, I'm happy to be working with Genentech, who is interested in making sure that we all are aware of flu and some of the new agents. They have a new flu drug called Xofluza, or baloxavir marboxil. It's a new class of drugs that is very effective in treating influenza. Like other drugs, it reduces the duration of symptoms by about 1 day, but it has the advantage of not only having a new mechanism of action to help treat the virus in a slightly different way from the other medicines that we have, but most importantly, it's a 1 dose and you're done. So a single dose, no other doses are needed for uncomplicated influenza.
How is it taken?
It's a pill.
Okay, so just swallow it, and hopefully you'll be feeling better anytime.
Yep.
Sometime.
Yep.
Now, what makes it special?
I think the thing that makes it special is that it's a single dose. So basically, unlike a lot of the other medications that are approved, you need to take the medicine for 5 days with the other therapies. With this one, you just take a single dose and you're done. You don't need other pills beyond that. Additionally, it has a different mechanism of action, and so if the viruses become resistant to our currently approved agents, it would be more likely to treat them.
Now, how can you find out if your doctor has this medication because it's so new?
You'd have to call the doctor and have them call the pharmacy to understand about the local availability of the medication.
Now, who is most at risk for getting the flu?
Patients that are over 65 years of age, patients that have underlying medical conditions, people that are morbidly obese, or people that are pregnant or have recently delivered a baby are at highest risk for complications of the flu, including hospitalization and death.
Now, where can people go to get more information?
They can go to xofluza.com, xofluza.com.
Is there anything else you'd like to add?
Just make sure that you get your flu shot if you haven't gotten it, and call your doctor if you're feeling sick as soon as possible.
Sounds good. Thank you so much for all this information.
You're welcome. You have a wonderful day.
You too. Bye-bye.
Thanks.